I believe we are 17 months into the COVID pandemic, and as it drags on, it is having a terrible effect on kids' mental health. Here's Dan Cummins.
Here are two facts for you from UNICEF and HealthyChildren.org. Since March of last year, 1 in 10 kids are now suffering from depression, and suicide is the second leading cause of death among school-aged children.
Most of us will agree it's tough growing up anyway, but the pandemic has made it worse for youngsters. Remote learning, isolation, loneliness.
I didn't like it when I couldn't play sports because I like to play baseball a lot, and I didn't get to see my friends a lot during COVID.
Wendy Wexler with Maumee Pediatrics. Since the pandemic began, they didn't have a single COVID patient go to the hospital. There were only a handful of things like strep throat, but spikes in panic, anxiety, social anxiety, and ADD.
That is a problem, and they weren't allowed to do their normal sports and activities because most kids thrive on sports, band, art, church groups, anything to be with socially with their peers. They were able to be socially with their peers on Snapchat and Twitter and Facebook, but I think kids need to be in person with their friends.
So as we enter a new school year, Wendy says, consider what's worse, the effects of getting COVID for some or an epidemic of depression. She believes remote learning is not the way to go.
I don't think it's a good idea, but they're not going to ask the pediatricians. They're going to follow the CDC guidelines. Kids need to be with kids. They should see that the mental health of kids was 10 times worse than the virus was for the kids.
I'm sure you can believe this. Some children have gotten so scared of COVID, they're scared to even take off their masks, scared to go out of their home and back into the world. The effects on a generation of kids that may last longer than COVID itself. Reporting in studio, I'm Dan Cummins.